with the Department of Health and Community Services, and I will be the moderator for the question and answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Well, good afternoon again, everyone. Minister Hagee, by the way, will not be with us today. He's in the House of Assembly. I think most of you would know that the legislator is sitting. so he will not be with us today. So it'll be just myself and Dr. Fitzgerald, and we'll be doing your media availability for today. So let's get started by turning it over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases in the province, and the total number of cases remains at 261. One person is in hospital due to the virus, and 256 people have now recovered. In total, we've tested 13,870 people. As businesses and activities reopen this week, I'm once again filled with relief and encouragement as we further transition into a more normal way of life while living with COVID-19. We've each worked hard to get here, and I hope you share in my renewed sense of hope and optimism moving to alert level 3 has provided. This is indeed a positive step forward, and it means we can now more comfortably enjoy summer activities and gatherings with families and friends, but in a modified way, as long as we can do so safely. We've reached this point because of your determination, your patience and understanding, and the tireless efforts of our public health officials to help keep us all safe. If it appears that throughout the pandemic we've acted out of an overabundance of caution, it's simply because we have, and our progress has been slow but steady. And as it goes without saying, every life saved from this disease is an important life worth saving. The COVID-19 virus and what we know about it is evolving all the time, and experts around the world predict a second wave, and if or when that happens, we must be prepared. So continuing to practice the tried and true prevention measures and adhering to the public health measures that we have in place will put us in the best position to respond should a resurgence occur. So as we begin moving about more freely, please continue to be mindful of your safety and that of others. Without exception, please stay home when feeling unwell, cover your coughs and sneezes, wash your hands often, and maintain physical distance of at least 6 feet or 2 arms lengths from others while in the workplace or any other public space. When you're unable to maintain a safe physical distance in public, please use a non-medical mask. This is especially important to help protect those around you who, for health or other reasons, are unable to safely wear a mask. Please keep in mind, though, that wearing a face mask does not replace in any way the need to maintain a safe physical distance or practice good hand hygiene. These actions remain our best defense against this virus. As we continue to move through Alert Level 3 and all remaining levels of our COVID-19 plan, please remember these 4 important words: people, space, time, and place. The significance of these words cannot be overstated. Simply put, the more people you interact with, the greater the risk of spread. So keep your number of contacts outside of your bubble as small as you can. Physical distancing is crucial to reducing your risk of contracting COVID-19, so be sure your space can accommodate this important protective measure. The risk of infection increases as people spend longer amounts of time together, and spending time together indoors is more risky than spending it together outdoors. So to help protect ourselves and those around us, let these be our guiding principles moving forward. We know COVID-19 has taken a toll on people's mental health and well-being, and just because our situation has improved since the virus first landed in our province does not mean that people are still not feeling the remnants of isolation and despair. So please know that you are not alone and that help and support is available. There are many mental health and addictions programs and services available in our province for people of all ages. So please visit bridgethegap.ca, and that's gap with 2 P's, to access age-appropriate programs and services that are available locally, confidentially, and free. If you are feeling anxious and alone, you can also call the Provincial Warm Line at 1-855-753-2560. 7 days a week from 9 a.m. to midnight to speak with a trained peer support worker who is there and ready to listen. If you or someone you know are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line at 1-888-737-4668 to speak with a mental health clinician. This service is available 24/7 to anyone who needs it. Even as our situation is improving, please continue to reach out to people among us who are still finding it challenging to cope with the effects of COVID-19. Sometimes an ear to listen and support is all it takes to lighten a person's burden in the smallest of ways while making the biggest difference. No act of kindness, no matter how small, is ever wasted. This pandemic has brought us together in an unimaginable way, and I hope the bonds that we have forged will continue to support an understanding environment that show people we care and gives them confidence that they will not be judged if they come forward and seek help and support. So as a recap, for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province remains at 261. While we live with COVID-19 for now, I'm confident that our shared respect, understanding, and a vision for a life without this virus will continue to protect, preserve, and strengthen our communities moving forward. We are in a well-earned place right now to resume our lives in a way that feels more normal than it has in months. So let's safely embrace this reprieve to enjoy the time with those we love. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Lucky number 13 again. It's been now nearly 2 weeks since no new cases of COVID in our province. So once again, keep that momentum and that good work going. We're getting a little more comfortable, as Dr. Fitzgerald said, as we get used to living in the level 3 of our alert system. And of course, I know many people are anxious and looking forward to moving into alert level 2. And I know many people would like to do that sooner than later, but of course it takes a team to be able to do this, and all those that are viewing today are part of that team. And with your support, it's how this will happen. We must remain vigilant and stick to the plan that's been put in place. Just practice safe physical distancing, proper hygiene, proper hand washing, and follow those health guidelines. So to the residents of Newfoundland and Labrador, once again, I think you deserve mention that you are doing a remarkable job so far, so let's keep it going. Let's continue to make sure that we stay safe and while working through this new normal. The interesting of note is that I notice, as you go into, some of the services that are now open, one of the things that we always hear are people saying, thank you for the work that you're doing, and always stay safe. So it's thank you, stay safe. So let's continue to moving forward with our plan to life with COVID. This has also been a very busy week for your elected officials, as we're all back now to the House of Assembly, as I just mentioned. That's where the minister is today. And we're in there today to put further supports in place to work with you to move through this pandemic. Now, as a friendly reminder for everyone tuning in right now, last week we made mention of some changes that would be occurring today at Service NL, and this is a department within government that provides many services that you use on a daily basis. So some of them services are resuming, and these have been available that have not been available since the onset of this pandemic. So it's a phased-in approach, as I've mentioned, for a number of in-person services currently underway. As of today, there's 11 full-time government service centers that are open. In those centers, you will see things like driver exams, written testing, and practical driver exams will now be available again. For those of you that need photo capture for new licenses or ID cards, these are the types of services that you will be able to receive on an in-person basis. But just a reminder, in order to have this service provided, you must make an appointment. It's a little change, but it's done to protect our staff, done to protect those that rely on those services. Now, we've given priority for individuals that have had appointments that were canceled because of COVID, and so they've been given some priority. I think that's the fair thing to do. And so the number to make an appointment is 1-877-636-6867. So if you needed to make an appointment, that's the number that you would call. And of course, for those of you that have urgent requests or extenuating circumstances, there will be provision to make you a priority as well. That would be people that if you had to travel, as an example, for work or for medical attention, if you needed a photo ID, these are the types of services that would be provided. Or in some cases, people just want to pay for those services by check. That's the only method they use. These are the kinds of situations that I'm referring to. So if you're in that situation, when you call the number to make an appointment, just ask for the registrar's office. Now, each office location, as I've just mentioned, from those government services centers has been assessed, and measures have been implemented to ensure that we have the safety of staff and the public including physical distancing. So although we are phasing in the in-person services, I cannot go without mentioning the incredible uptake that we've seen on our online services that are available at gov.nl.ca. And since the public state of emergency, the public health emergency has been put in place, as an example, more than 98% of the vehicle renewals have been conducted online. If you compare that to last year it was at 75%. So that's a significant growth in using that online service. But it's not just the vehicle renewals. We're seeing people getting their driver's license renewed online as well, and a significant uptake. Since the pandemic, it's been 92% of the driver's license renewals done online, and this is compared to 47% during the same period last year. So we are very pleased to be able to offer those services online during this unprecedented time. And you have obviously been responsive, and I want to thank you for adjusting and taking advantage and availing of the mygov.nl.ca services. So in addition to providing assistance for services online, we've also put in place supports for the tourism industry. This was one of the first industries that we quickly made some adjustment for, because they're one of the ones that's been hit extremely hard during this unprecedented time. So there's been a $25 million program that's been put in place to support tourism. And this has been put in place along with a number of initiatives that tourism operators and hospitality operators can take advantage from the federal system as well. So these complement each other. From the provincial point of view, what tourism operators said to us is they needed something that wasn't a loan, something that was non-repayable. So there's a one-time contribution of $5,000 and $10,000, depending on the size and your revenue in the past. So this is what they were looking for, was something where they could support some of the fixed expenses that would have been coming up on an annual basis at this time of the year, when normally they would be reopening with quite a few clients waiting to come in. So we opened that portal, and we're just in day 2, and in day 2, it opened up on Monday, late Monday afternoon. There's some 248 applications that's been submitted, and that's as of noon today. So in sticking with our business community, our business response team is a team that many people are relying on, and they help businesses navigate through the alert system. Now, we've been guiding businesses to various resources and guidelines on how to operate in the way that protects workers and customers for potential risk of exposure to COVID-19. So to update you on how that team is doing, they've been extremely busy as well. So they've been assigned over 1,200 inquiries that we would have assigned right now. They've completed, by the way, some 1,223 submissions. And just a breakdown on how people are using that system, some 64% have been using email, and some 36% are still using the phone. So if you have inquiries, I guess the message here is you can actually email or call the business response team. Look at our COVID website where you will find the most updated information related to COVID in our province, and you'll get the information that you will need there. Also, for those of you that are in not-for-profit or community organization, even municipal offices, there's posters and information that's provided there that will allow us the consistency that's required on how you adjust and adapt to living with COVID-19 in your business or your group. So we'll be happy to help you in your business or your group, which in turn, by the way, helps those residents that use those services and indeed support our economy. So to provide continued support to businesses in dealing with COVID and our pandemic, there's been also a 2-month extension for tax remittance, and the new deadline there is August the 20th. And that's an example. If you are a monthly filer, this means that you will now have the option to extend the filing time of those tax amounts. They would have been normally from, let's say, February to June. You can now extend this into August the 20th of 2020. So that's some extra support and making some cash available to our businesses during this difficult time. Also, just a reminder to many seniors, we've been receiving many questions about the announcement that was made for a special payment that was announced by the federal government last Thursday. And this special payment will be available in early July. And just to clarify some of the I guess, comments and questions that we've been getting and what this special payment would mean. So if you're an old age security pensioner and you're receiving that benefit or a guaranteed income supplement, if you receive the guaranteed income supplement, that there will be a one-time tax-free payment that you will receive on the week of July 6th. So this is, of course, on top of the existing benefits. And for an example, for those of you that receive old age security, you will receive an extra $300 on the week of July 6th. Also, for those that receive the guaranteed income supplement, you will receive an additional $200. So in combination, that's a total of $500. I know we have a number of individuals out there, too, between the ages 60 and 64 that receive some special allowances, and you will receive an extra $500 on top of the existing benefits that you would normally get. So all in all, this is a way to help support some of the most vulnerable residents and the extra costs that they've had to deal with and they've incurred during the pandemic. And it provides greater financial security at this particular time. So very pleased to say, too, that the All-Party Joint Committee, all our MHAs, our ministers, our departmental officials, many of our public sector workers, along with, by the way, our federal government, we're all here to help you and your family during this pandemic. So we must continue. I think it's important that we continue to work together to introduce new supports or or just simply enhancing some of the supports that's been in place for quite some time. Our approach has been one of balance and supporting each other through this pandemic and putting the important health measures in place so that we all continue to work together. And I think, as Dr. Fitzgerald just mentioned in her comments, you can see the benefits of a province working together, supporting public health and sticking with the public health measures that have been put in place. And we see the outcome that we're seeing within our province. So let's keep the momentum going. Let's stay determined. We're moving in the right direction. If our recent results are any indication, we're getting in a better position so that we can make progress and move into alert level 2. We know that collectively working together as a province that we can do this. So right now, I will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press star 1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Thank you. Dr. Fitzgerald, I'll throw this one at you. Normally it would be the minister, but he's otherwise occupied. We saw health authorities today announcing they're easing restrictions. So, for example, long-term care will have 1 designated person. Can you give, there'll be some people that will still wish they could have more. Can you give me an idea of A, why did you want to ease the restrictions, and B, why do you feel that it's not appropriate to lift them even further?
Sorry, Peter, I was missing some of what you were saying there. You were breaking up a little bit. Can you repeat your 2 questions again?
Sure, it's rare people can't hear me.
I got you now, no problem.
So the question is for the lifted visitors restrictions that we're seeing in place today. 1 designated person for long-term care, for example. Can you give me an idea of the balance that you're trying to strike here in terms of what you're hoping this will achieve by allowing people to have more interactions, but also why you don't feel that it's okay to be able to go back to the way it was before?
Great, thanks. It's a good question, and certainly a question that we've been asked a fair bit, but what we know is, our long-term care, personal care home populations, they are particularly susceptible to severe disease, and if, we don't have to look very far to see the consequences of COVID getting into one of these facilities. So we certainly don't want that to happen. We recognize the importance of visitation for people who live in long-term care, personal care homes, and other assisted facilities. So we want to be able to give back some of that connection. I think we, the facilities themselves have to be able to make sure that they're able to implement these things safely. So I think starting with one person coming in, a designated visitor, is a good place to start. And we'll be certainly looking at how this rolls out and how things go. And if it looks like things are going well, then certainly we'll consider expanding that at some point down the road. But we have to be cautious because, there is that risk with this population, and we want to make sure we're giving a balance of safety and other health-related concerns as well.
When you look forward to the rest of the summer, we haven't seen yet what the gathering numbers will look like for Alert Level 2 in a couple of weeks. I've heard a lot from a lot of brides as well as people in the wedding industry wondering, can a wedding go ahead in July or August? If you had a kid who was busy preparing for a wedding this summer, what would the advice be that you would give right now?
In general, or just no? So, weddings can go ahead right now. People can get married. They just have to be small gatherings. And that's certainly something that we are looking at. We're looking at that not just here, but we're looking at it across the country. We recognize that some of these social and cultural gatherings are important to many people's lives. And so, again, we want to be able to to have things go back to normal, but to do that safely. And so I think we need to really look at we're still very early into this, and, we've opened up, a lot of things have opened up, a lot of things have changed. So we need to take some time to see what effect that's going to have, first and foremost. And then I think we'll be able to make a better decision at that time, or a good decision at that time, what kind of gathering we can look at. But whatever it is, whatever the number, it has to be done safely. We still have to think about physical distancing. Those public health measures are not going away anytime soon.
Premier, last question is for you. At the end of the month, not every parent is going to be ready to send their kids back into childcare. Providers have been telling, or some providers at least, have been telling parents you either have to pay for that spot or you're going to lose it as soon as that government funding runs out. Other provinces like Ontario have said that child care centres have to keep those spaces open and aren't allowed to charge. Why aren't we doing that here?
Well, it's not something we're considering right now, because I think if you look at this for what it is in about maybe 2 or 3 steps, if you go back to pre-COVID, essentially where we were last year at this particular time, and as we move into Alert Level 2, we're getting very close to the situation that we would have been into last year. So right now we have 70% capacity for child care centres. I know, but just by the history of what would happen from what we've been told by enrollment once school closed, is that it was not unusual to see the enrollment drop in child care centres. So when you look at and you do the analysis on what we've done as a province, we've been very generous to our child care centres around our provinces, some almost $15 million that have been gone into this industry, and we treated them as if they were full. So I would expect that it is important for the child care centres to work with their customers, people that have availed of their service, and try and be fair with them. And if we need to monitor and look at a review, something that's happening here, what we do not want to see is to put people in a situation that will require that child care space. As an example, we do not want to see them compromised for a service that they would want to use, let's say, in September. So we expect them, as a service provider, to treat their customers fairly, to treat the families fairly, and if we need to take a look at this, we will. We have treated this sector in our province right now very generously and provided them a lot of supports. We provided them as if they've been full for the last 3 months, and we paid for their staff.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, I'm wondering if you're able to speak to this. Eastern Health has put out now guidelines on visitation when it comes to long-term care homes, palliative, intensive care, obstetricians. things like that. Central Health has put out something similar. I'm wondering if all the regions are to have the same guidelines, and what long-term care homes, if they're building their own strategy, should be taking into consideration.
So it is my understanding that all of the regional health authorities will be, have had input into the guidelines, and this is something that will be as consistent as possible across the province. And, you have to take into account local context sometimes, so there may be slight differences, but for the most part, I think everybody will be trying to stay on the same page with regard to visitations. Long-term care facilities fall under the regional health authorities, so their visitation will be, will be monitored and dictated by the regional health authorities. And personal care homes have also been included in that, in those conversations with regard to allowing for visitation. But again, every personal care home is a little bit different from the next, so you have to have some local context as to how the recommendations can be carried out safely in each facility. So there may be some subtle differences in the way that that's carried out, but the principles and the guidelines behind it will be the same.
Thank you. And this question is for both you and the Premier. I know it's something I've gotten a lot from the general public, and I'm sure you've seen it as well, of many people wondering at this point how much of these guidelines and restrictions are actually public health and how much of it is political and policy. Because when you look at some of them, it's not always making sense that I can go and get a tattoo now, but the breast screening clinic in St. John's isn't opening in level 3.
So certainly we make public health guidance based on the best evidence that we have, and the regional health authorities are opening their facilities as they see the best way to do that. So there are other considerations for the regional health authorities than just strict public health considerations. There's things like PPE, and there's staffing considerations and other things. I'm not working within the regional health authorities, so I certainly wouldn't feel that I'd be able to comment in any great detail on that. But there are other considerations besides straight public health considerations when reopening.
Yeah. So from the political piece of your question, I mean, even the all-party committee that we put in place back, many weeks ago, right now, we made a decision collectively amongst us that we would rely on our public health officials based on the evidence and the science. So I'm not here, and we have not, any of the three leaders that participate have said, we need to see this opened or this here open. Of course, we speak to people that use those services, but we're not here to influence a decision. We base it on the advice of our public health officials. That's the position that we took from day one. We'll continue to stay there based on the science and the evidence. I know a lot of the decisions would be extremely difficult, and I understand the frustration on just the example that you gave. But from a regional health authority, they have a number of things that they have to consider in terms of, utilization of the acute care facilities, from a bed occupancy, the staffing that's available, the PPE that's available, as an example. All of these things, put extra pressure on PPE. So these are decisions that are made within the regional health authority. As Dr. Fitzgerald has said, they are responsible for this. So we're not here to say this particular service should be available and the other one not. That is not the type of influence that we put on our public health officials, and we shouldn't. We base it on evidence and science.
But shouldn't the Department of Public Health, be advocating for some of these services, like a breast screening clinic, health mammograms, and can screen cancer before most? I mean, to me, that seems pretty urgent.
Yeah, and I can understand on a regular basis, and I think that some people would rely on those, types of screening procedures on an annual basis, and sometimes maybe even more frequently. Is a good example. You raise a good example, and one that would be very difficult, politically or even from a consumer to be able to explain why, that would be in place. But the regional health authorities, they would be in place, I guess, to answer that question because they take more information. On the surface, it would seem that the breast screening service should be available. I would like to see it available, But yet, from a regional health authority's point of view, they have other considerations. And indeed, these are usually clinical decisions that are made by those that order those tests and so on, or those that require this screening on a regular basis. So I'm sure that we'll get in a position to be able to do this with the appropriate amount of PPE, staffing, space available within our hospitals, that this is something that those that are making that decision, they want to get this done too. There's no question there's people deliberately staying in the way here. That's not what's happening. They're just making the decision so they can provide those services safely. And we want to get those that require those screening. We need to get them available as well. We all want that, but we must do it safely, and I'm sure the regional health authorities are looking at that.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Question related to long-term care facilities. I just kind of get a sense of what this is going to look like. How would it? Can you walk us through what a visit could look like for people who are going to visit their family members? Will it be one visitor at a time? Are people going to be allowed to go into their bedrooms, or will there be a sort of a common room for visitors? Can you give us any details related to that?
So, I can't get down into the details of every home and how they're going to do this. Obviously, that's something that has, again, that's that local context that you have to consider. Some homes have a lot of private rooms, so in that situation, visitors may be able to come in and go directly to their loved one's private room. They will stay in their private room, they'll wear a mask, all of the precautions that you would take. In other homes, there aren't as many private rooms, and so there has to be a way to ensure that the safety of all the residents are in place. So that may involve them having certain designated rooms where people could go to visit. In some places, this may involve more outdoor visits because they have some lovely outdoor spaces, for example, that they could have people go to on nice days. And in those situations, that would be a little bit different than if they were having indoor visits, right? So it's a bit variable, and so it's difficult to say for sure. What we know is that for the most part, people will need to designate a visitor, and that person should remain consistent. If there are extenuating circumstances, that may be able to change, but for the most part, they need to remain a consistent person, and that's to make sure that the fewer, as I've said, people, space, time, place, right? So the fewer people that are coming into contact with people in the nursing home, then the better that is. So we want to make sure there's some consistency there in the person. But it'll be probably as variable as there are homes and personal care homes in the province.
Yeah. So Dr. Fitzgerald, Dr. Fitzgerald's right. I mean, for many people, when you look at a floor plan, and they're not, they're quite different, even in long-term care homes and personal care homes. Every home is different, no different than your normal residence. So as people would build those, personal care homes or those long-term care homes, they're all different. So you need to rely on the people that would work in those settings. The whole idea here is to reduce exposure and points of contact along the way, so that if you're coming from the outside to visit a family member, to visit a loved one in one of those facilities, is really that you can make the visit, to your parent, to your mom, dad, or brothers or sister, or whoever you're visiting there, your friend maybe. And so the whole idea here is to limit the exposure, the points of contact along the way. And keeping in mind there's, some other aspects of this as well. The demand that will be on staff, that, sometimes it will require, cleaning and extra cleaning and so on, as there's, the number of steps between the points of contact are all to determine on what a proper plan would look like. So I think people, the managers and those staff that work there will be doing this, working with families to make sure that you can do it safe. The last thing that we want is to see some of the most vulnerable. We know the statistics as happened in other provinces. We saw the results and the outcomes. So trying to find that balance once again, because we know there's a lot of positive things from emotional, health-wise, that can come to having loved ones visit their seniors in those long-term care homes or personal care homes. There's a health benefit to that as well, but COVID adds a new element to this that we must need to factor in. So these staff know it the best, regional health authorities. They monitor, by the way, on a regular basis those homes. So it's important that we make sure we get them in the decision-making process so they can do this in a safe way.
There's going to be a lot of people who are happy to hear this news related to personal care homes and long-term care facilities. How are you going to control flow? There's going to be a lot of people who want to go visit these places. I guess what measures are in place to make sure that there aren't too many people at once?
So I think the homes will have to put some processes in place that will take that into account, and certainly good communications with family members of the residents. That's important to make sure that they understand the procedures that will have to happen. And again, that may vary from one home to another. Smaller homes may not need to have appointments set up, and larger homes almost certainly will, because you don't want to have hundreds of people necessarily in a home at the same time, visitors, I mean. And so, you know, there's a few different things to consider, but yes, you know, all of these facilities recognize the need to be able to control the flow to some degree, and to keep track of what visitors are entering the facility as well, so that if there is, heaven forbid, an outbreak, you know, we can do contact tracing more easily.
Premier, I'd like to ask you a question about controls of the border as well. Would you be able to confirm that under the process for exemptions that we have now, American residents with close families in Newfoundland, Labrador would be able to enter the province, while Canadian residents in a similar situation with close family in Newfoundland, Labrador would not be able to enter the province?
No, Canadian families, those that they can come in under the same process. There's an exemption order that's been put in place. It's consistent and similar to if you're reconnecting with a family member and you come, your point of origin would be in the United States, coming across the Canadian border. This was a decision that was made by the federal government, you know, to bring them into Canada. So if their destination would be in a province like Newfoundland and Labrador, they would follow the same rules as the exemption orders that we would see in place for those traveling from one province into Newfoundland and Labrador, no different than if you're coming from the U.S. into Newfoundland and Labrador. It's the same process. You use the exemption order.
Yeah, and we have always allowed for family reunification in those exemptions. So anyone who is visiting a child, or if a parent was coming in or a child had to come in, that was allowed already in Canada.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi. This may be kind of moot now that the seniors' homes are opening. But in terms of long-term care and personal care homes, particularly personal care, which are not run by the RHA, what sort of monitoring of incident reports has been taking place in the absence of family members?
So I can speak from some experience, I guess, within the personal care home. Within personal care homes, the monitoring has been in place. One of the things that we've been seeing in other provinces, and I make this point quite often to my federal colleagues and other premiers, is that we can be very proud of the monitoring that's happening and the regulations that we have in place in Newfoundland and Labrador to protect the staff that work there, and primarily to protect the residents that live in those homes. So there's an aggressive monitoring, aggressive regulations that are put in place, even down to the number of staffing hours, as an example. So this is the type of monitoring that you will see in Newfoundland and Labrador. So even though, as you just mentioned, Peter, they may not be owned by government, they're owned by private investment. What you do see, though, are heavily regulations from the province to make sure that those people are kept safe, those residents are kept safe. So this monitoring has been ongoing through this pandemic, and it's been ongoing and in place pre-COVID, during COVID, and post-COVID. And we do that to protect the residents that live there.
Okay, thank you. I also wanted to ask about sports groups, including softball groups, for example. The 20-person guideline, it's like it just doesn't quite come up to fielding a full team. If you have officials as well, even an increase of 5 or 10 at the most would do the trick. Why is this not a consideration?
So, you know, when we made our decisions about the number of gatherings, it was based on public health advice and evidence, and not really on what sports teams would be, you know, able to do. That's not really something we had to take into consideration for that. So, you know, we appreciate that people want to be able to play these sports, and we've given guidelines. We've consulted with their sports federations and their sporting groups to you know, give advice and guidance on how that can be done within the parameters of the public health measures. But ultimately, I think the sports associations have to be able to take that information and play the sports as best they can within those restrictions. You know, it's not back to normal. It's a modification of normal. So, you know, we're slowly getting our way back there, but we're not back to normal yet. So, you know, I think we all have to keep that expectation in mind.
So, Peter, I think, you know, to your question, if you look at what's happening even within, you know, professional sports, I think, you know, as Dr. Fitzgerald has said, you know, the whole idea here is to try and keep people to get back to what will be, or to live with COVID and what will be a new normal. So things have changed considerably from a competition point of view. But if you look no further than what we're seeing within pro sports and some of the entertainment and some of the things, I guess, that we would all look forward to in this time of the year, I'm sure you're like most of us. And even those professionals are struggling to actually determine how they can actually get to play their sport safely. So there's a lot of work going into this, and this is really about, you know, providing some relief for, you know, residents in Newfoundland and Labrador, and all of us, you know, that would enjoy, you know, sports in a general sense, realizing that they have changed considerably. And I've noticed it. You know, I'm a bit of a, you know, I like to, you know, watch a bit of this myself. And if you just look at some of the older stuff to where it's going to be in the future, there's going to be big changes. And people, even those that enjoy sports like I would, will have to adapt and maybe even take on some new sports. Who knows what the future would look like. But really, this is about a way of getting people actively engaged again in some of the sports that they enjoy, but in a very different way. And hopefully, as we get, you know, more information about living with COVID, that we can even make further adjustments so it gets back to closer. It can get closer to what it used to be in the past. But, you know, it's just not there yet. It's just starting to open up, and adjustments are being made. And I encourage people to get out and enjoy the sports under the new formats, whatever they will be. And, you know, this is where we are in this particular point in time with COVID.
Okay, so take out the short stuff.
Yeah.
I'm wondering about our the number of cases again. It just seems so odd that we've only had one case in the past 5 to 6 weeks, and yet we still have 2 active cases. How is that possible?
So, active cases are defined in a couple of. So, okay, no, let me back up. When we have somebody who gets sick with COVID, if they are not seriously ill, so they don't require hospitalization, and they may not require ICU, if they can, you know, be recover in the community, then what we say is if they're 10 days post diagnosis or post symptom onset, and they're symptom free, then we consider them recovered. So they would no longer be an active case. However, if you have somebody who has been admitted to hospital, that usually means that they have more severe disease, and generally speaking, they tend to have higher viral counts when they have more severe disease. So there's a higher risk that the disease could be spread. So we're a little more cautious in that situation, and so what we want then is 2 tests done at least 24 hours apart that are negative before we would consider them recovered, and provided they also had resolution of their symptoms. So there are you know, some cases where it actually takes a long time for people to stop shedding the virus, and so they continue to have positive tests when we test them. So they're not technically considered recovered, so we still would call them an active case. And that can take quite some time. Across the country, we've actually had people up to 8, 9, 10 weeks before they actually stop shedding the virus and have those negative tests.
So, Peter, that's a very good question. And we had a long discussion even today at our all-party committee, and this exact question comes up, and the explanation, I think, is a great one, because I know when people look at the incubation period of 14 days, they would think then, okay, then normally now there's one less active case. But I think Dr. Fitzgerald just gave us a great explanation about active cases, and I know it's a question that's been on the minds of many people in the province.
Thanks.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Premier, I want to ask about something you touched on in your opening remarks about how online service has really flourished in this time. And I was wondering, are there any services that will stay online and maybe never go back to in-person service?
I think they will. I think people have adjusted, and I know we've put a program in place, within government, and we put more services online using digital services. If you remember, and probably for those that would have followed this back a few years ago, we put a big plan in place. We get more services online for people as part of regular programming. And right now, so the programs that we're seeing today, as I just mentioned, around vehicle renewals and driver's license renewals and others, they've been around for a while, but we're seeing now that are people that are using them simply because you just couldn't go in an in-person. And so I think you will see people that will adjust and never go back to the in-person appointments or the way they provided those services. And I will continue as a government to explore new opportunities. Matter of fact, we were at some meetings yesterday, and there's a number of opportunities that we could actually use as a government to provide more services online. So then it really doesn't matter where you live. It doesn't matter about the appointment. You can actually make those decisions and use those services at your convenience. Of course, then the big question comes down to the availability of broadband. And so we're having those discussions with the federal government, how we make sure we can, get speeds up, get the capacity up for access to broadband. It's important. We've seen the increase in virtual care as an example. I know some physicians have been using the telephone. Some have been using this, by other mechanisms. And we've seen meetings that have been occurring by Zoom and all the other programs that have been in place. So I think you're going to see, as a result of COVID and this pandemic, that you will see many, many more services that will be delivered online. And quite frankly, I think people have become very productive and have done some great work working from home. And so to answer your question, yes, I believe you'll see more of it. And no, I do not believe that we will go back to some of the old ways of doing things. I think this is about adaptation of where we are, but have been creative, and we'll see this well into the future in a normal life, or whatever that new normal is.
Thank you. And I also wanted to ask a bit more about the business teams that have been put in place. I'm wondering how many people are on the team, and what departments are they being drawn from?
Yeah, they're being from TCII, and so there's a number of people there. And from a tourism point of view, it would be primarily those that would have been focused within the tourism sector of that department. As you know, that's tourism, culture, innovation, and industry. So there's a number of components to that department. Some, as an example, a provincial parks program and those sorts of things would be in there as well. So I don't know the exact number that would be there. All I do know, they're very busy in processing quite a number of applications. I know on the opening day, there was some 25 per hour that was coming in. And so they ramped up pretty quickly there, as I just mentioned, some 248 in just 2 days now, as of noon today. So, and they will put people there that's required, because the whole idea here is to get that money out the door as quickly as possible, because we know those operators have been waiting for some relief to help them support some of the bills and the invoices that they would have coming in at this particular time of the year. So they're responding pretty fast to this, and there's the number of people that's required will be there to support those applications that are coming in.
And I was wondering, back in late March, a $200 million contingency fund was created to kind of address certain COVID needs that were pressing. And I'm wondering, at this point, how much has been spoken for from that fund, and how much has been distributed?
Yeah, about $74 million to date of the $200 million. And the tourism sector, as I've just mentioned, some $25 million. The renovation rebate program has been getting quite a bit of an attention as well. That was $30 million. So if you have renovations to do to your house with a registered contractor, 25% of that would be rebated. So if you got $40,000 worth to do, $10,000 would come back from the rebate program. And this was just a way to create jobs and get that construction industry back to work. So it's about $74 million of the $200 million that's already been we put out there in the system, and there will be more as we continue to move through this. But we'll put the priority where we think the areas that would need it the most. That's the reason why we put the tourism sector out there first.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. Virtual visits have been encouraged since the introduction of the public health orders. We're just wondering, will MCP continue to cover these virtual visits even after the pandemic slows down?
I think this was something that was in place, and we were working with the NLMA, prior to this pandemic, and something that we would have wanted to see in place, prior to dealing with this. But this has been a great opportunity to actually get people to adapt to this and try this, and I think has been very successful by the responses that I've been getting from the physicians that have used it, but also by the those that have received those services. Of course, there's always a need, and I think most physicians and most healthcare providers will tell you that this is not this is really complements some of the work that's been doing from the provision of healthcare, and Dr. Fitzgerald would know more hands-on about this than I would, but this really complements as an additional opportunity for people to actually see their physician. But face-to-face visitations and appointments, is something that will always be, I think, at least from a user of some of those services, would always be something that will be must be available as well. So it's been complementing what's been ongoing, and something that the NLMA and the department has been looking and exploring for quite some time.
Thank you. And those in the tourism industry are wondering why there hasn't been something like a tentative date set for reopening borders, so they can figure out things like reservations for those outside or inside the province who are wondering if they should book or cancel their reservations, as many of these places book up far in advance for a good portion of the summer.
Well, I think first and foremost we should remember that B&Bs, hotels, they were never shut down during the pandemic. You could always go and stay in a hotel. These services were not shut down. It was the fact that people were not moving around that it became down to demand and the number of customers that would be out there. So right now, it's opened. It's open now and we'll be promoting a staycation within Newfoundland and Labrador. So that's been out there, so people have a little more freedom of moving around as they should and explore some of the great things that we have in our province. So for those that are coming into Newfoundland and Labrador, there's a plan that's been put in place through the exemption orders. There's some, I think, upwards of almost 6,000 people now that have made applications to come into our province, and we've talked about those that have been denied up to around 13-14%, I think the number is. So there's people coming in, but you must come in using the procedures that have been put in place through those exemption orders. So that's where it exists today, and until we get it into a situation that where we can move around our province safely, and then I guess using the advice and the evidence that we see what's happening inside a province and outside a province, the evidence and science that will be used then by public health officials to see if we're in a position to even relax those measures even more. These are decisions that will take some time, but keep in mind, safety, public safety is always first and foremost in those decisions.
Thank you. And those are part, again, back to softball, those are part of the softball leagues in the province are saying that if team sports are allowed to go ahead, why aren't the fields opened yet for use? I know this is on municipalities, but why do you think that they're so far behind public health?
Well, I guess when you think about it, it's getting their own workers back. Then I can't speak for the municipalities and the decisions that they would have to make, but I guess they have to work within how that workplace is then safe for them to work. If there's preparation, where some softball fields or soccer fields, or they can be it can be ready for people to use them. That could be different in each community based on the supports that they would have in place to be able to do that. There's no question, especially in the springtime. There's a lot of priorities and a lot of pressure put on many of our towns and our cities to get those facilities open, but there's pressures on in things that are occurring. I mean, keep in mind, this is usually, cleanup time around our communities as well. So there's a lot of pressure. Sometimes there's competing pressures on how we best utilize the staff that's available in those communities.
Thank you.
Thank you very much for tuning in. The time for questions has ended. Please join us again on Friday, June 12th at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.